So shall we begin now?
Okay.
Good evening, everyone. Welcome back to another interesting session with Team CAME. It goes without saying the importance of Ayurveda in the beauty industry. Every day, we come across lots of tips, tricks, and products that claim to enhance your beauty overnight or grow your hair magically. And the patients often come to us confused. So, as Ayurvedic practitioners, it is our duty to identify the reality and the pure Ayurveda from the gimmicks that confuse the patients. So, with this aim, we present the topic Ayurvedic approach to common cosmetic problems of scalp and face. And we're so lucky to have with us the very energetic and beautiful Dr. Zayana Zella, who is an Ayurvedic doctor practicing cosmetology and trichology at Dr. Zayana's Ayur Wellness Center in Tirur, Malappuram. Dr. Zayana completed a BAMS from BPSB Ayurveda College, Kottakkal, and has done diploma in beauty therapy and MSc clinical psychology. And apart from cosmetology, trichology, her area of interest also lies in adolescent and premarital counseling and psychology in general. So she has successfully treated over 375 plus trichology cases throughout the years. And with huge pleasure and pride, I welcome you to conduct this session. Thank you so much, ma'am, for being with us today. And I welcome all our dear participants. So we'll begin without any further ado. Thank you, ma'am. Now you can take over the screen.
Good evening, friends. Today, I have come to know that today it's the another session of Team CAME. First of all, I congratulate this team for conducting such enthusiastic sessions. Already, some sessions have been finished. Okay, so today my session is about trichology, mainly trichology. We all know in today's atmosphere, most of the people come in our OPs. Even if we are treating for some other cases, they will be coming to our OPs and telling they have some issues with their hairs, they are having hair loss, hair thinning, split ends, etc., etc. Or some are complaining about alopecias and all. We are all coming across some of these cases in our day-to-day life. And we all know that people are more concerned about such problems because they have a great cosmetic effect, especially skin and hair. It has a great cosmetic effect in giving us a positive attitude or building up our identity and all. So today I will be discussing some common cases coming into our OPs regarding trichology and facial problems and all. Whenever we are studying, we all know usually this trichology cases are not usually taken by Ayurvedic professionals. I don't know why. Patients don't know that there is something we have to give in these cases, or we as Ayurvedic practitioners, we have a lot to do in giving success in these trichology cases. Usually we all move on to the comfort zone. We are not ready to take risk, but while studying about the physiology, anatomy, and each cases regarding baldness or alopecia, we will get a lot of positive points or loop points that it will give us strength to treat such cases in trichology. So first of all, to start on with this session, I think I'll just brush upon some anatomy factors about hair. While treating hair cases, we should know what is our hair and what is the structure. We might have studied, but still I'll wish to brush on to that knowledge. Okay. So as we all know, hair is an ectodermal origin. No. So it is this hair is a simple structure of protein filaments called keratin. We all know each our hair has got mainly two parts, a root part and a shaft part. The root part is seen below the, excuse me, let me share the screen.
Sure, ma'am.
Okay, we all know this. It is a protein, simple structure of protein filaments, and it has got two parts, a root and a shaft part. Each hair has got root is found below the epidermis, and the shaft portion is seen above the epidermis. Now, coming on to the hair roots, we are always concerned about the hair shaft, but we should know the hair roots should be very strong for getting a good hair, a good density, well-densed hair. So this hair root has again divided into two parts, a hair follicle and hair bulb. On coming to this hair follicle, it is the most important part of the hair, and it is called as the living part of the hair. Hello?
Sorry for the interruption, ma'am. I request all the participants to please mute your audio.
Okay, so let's continue. We all know this hair follicle. It is the living part of the hair. It is a sac that surrounds the hair root, and it extends into the dermis. Okay, so it has got actively growing cells in this. Its bottom part has got actively growing cells, which include two types of cells: the derminal cells and the melanocyte cells. The derminal cells are the cells that give nourishment to the hair, and the melanocyte cells give color to the hair. Okay. Now there is a muscle part of the hair, and that is the erector pilae muscles. Then there is a gland that is which produces sebum, the sebaceous gland. This is something about the hair roots. And on coming on to the hair shaft, we all know each hair shaft has got three parts, that is the outermost three layers, that is the outermost cuticle, the middle medulla, and the innermost. There is a small mistake in this: the outermost cuticle, the middle medulla, and the innermost cortex. Okay, see, this is the picture of the shaft and the inner hair root. You can see the hair bulb, hair papilla, hair follicle, erector pilae muscles, sebaceous glands. So this outermost part is called the cuticle part. We all know the cuticle, this protects the inner layers of the hair, and it gives the shiny appearance, smoothy appearance to the hair. The middle part, medulla, it almost gives 90% of the total weight of the hair. And the innermost cortex part, it is the innermost part, and it is usually found in thick coarse hairs, not in all hairs. Okay. Now coming on to the physiology of hair growth, we all know that this growth rate of each hair ranges from 0.3 to 0.4 mm per day. Usually in 1 year, each hair will grow about 6 inches. Usually people or patients usually ask us, my hair is not growing, my hair is only this much long since 1 year, or since 2 or 3 years, it is in the same stage. And also we will have to explain about the hair growth. Okay. Now, in each hair growth cycle, it includes 3 stages. That is the anagen phase, the catagen phase, and the telogen phase. You all know the anagen phase is said to be the growing phase of the hair. It is the most important phase, and it is the active phase, or it is a very faster phase of hair growth. Okay, then usually in this phase, the cells in the hair roots divide very rapidly, and new hairs come and grow over the old hairs. This anagen phase usually extends from around 2 to 6 years. Since as in some hairs, the growth will be stopped, and in such hairs, the anagen phase will not occur. Okay. Now, coming on to the second stage, the catagen phase, or the transition phase. Usually in this catagen phase, around 3% of hair growth occurs, and usually this phase occurs extends from 2 to 4 weeks. Here, what occurs is that the hairs in the roots get attached together, they form a club, and then starts to shrink. Now, the third phase is called the telogen phase or the resting phase. 0% of hair growth occurs in this telogen phase. Usually it extends up from 2 to 3 months or around 100 days. After 100 days, what is occurring is that the hair is get pulled out. So we are saying that my hair is falling out. Okay. The most important factor I am reminding you in this case is that usually in a normal individual, around 25 to 100 strands of hair usually they is pulled out daily. 25 to 100 strands of hair. So if the patient is complaining, my hair is falling out very rapidly, it's mostly patients say around 30, 40, then it's normal. So that is not the case of they are becoming baldness. So we have to think, then why are they getting bald? Why are some people getting bald? But we have to assume that the reason for the baldness or for hair loss is not the hair is getting pulled out. If that is the reason, then it should be more than 100 strands of hair. So the reason is that new hairs are not regenerating. So if this should occur, if new hair should regenerate, then the anagen phase should be completely, it should be complete, or it should be taking or starting very rapidly or occurring. It should occur in our scalp. For this anagen phase to occur, nutrition is required. So that is a point which I should remind you. I think I'll explain it more in the treatment protocols. So you can see the anagen, catagen, and telogen phase, and the new hair formation. The cycle starts over. These all phases occur in each strands of hair. Okay. So the best treatment time, it's shown there. Resting phase. So the best treatment time is in the anagen phase. Okay. Now, so in this anagen phase, we should give good nourishment to each and every hair follicle. That is, the blood circulation to the hair bulb and the hair follicle must be increased. Then in the catagen phase, the hair follicle detaches from the nourishing blood supply, and in the telogen phase, the hair dies and falls out. Now coming on to the pH of the hair, we all know the scalp pH is different from body pH. Scalp pH is naturally acidic. It is around 4.5 to 5.5. So while using this showers or some soaps and shampoos, we have to keep this in mind. Then next is the hair porosity. Is very important. Hair porosity is very important. It is the ability to absorb and return moisture in the hair follicle. So while doing treatment, before starting the treatment, in any treatment in hair, we should look for this hair porosity. There are 3 types of porosity. That is the high porosity, medium porosity, and low porosity. In high porosity, the outermost cuticle will be raised. It will be very open. So while applying any medicines, any oils or any medicines, the medicines will get into the hairs very rapidly. But as soon as the medicines are absorbed by the hair, it is also, the hair also loses the medicines. So high porosity is not a completely good hair. Now, the second one is the medium porosity hair. In medium porosity hair, the cuticles are loosened. That's a good hair. And in low porosity hair, it's closed. The cuticle is closed. So it is a very dry hair. Whatever we apply on the hair will not get into the hair shaft. Okay. So we have to test for this porosity. A very simple test we can do in our OP is just take a glass of water, take a strand of hair and put it in the water, in the glass of water. Just soak the hair in every part of the hair and wait for 1 to 5 minutes. In high porosity hair, we can see the hair will shrink completely in the water. The hair will be standing in the bottom part of the glass of water. In medium porosity, we can see it will be in the middle part of the water, and in low porosity, it will not get immersed. It will stay in the upper part itself. Okay. So while doing treatment, first we have to look for the porosity of the hair, and if it is low porosity hairs, we have to convert it. The best porosity is medium porosity, second one high porosity, the worst is low porosity. So if the hair porosity is low, we have to convert it into the medium porosity hair. So how can we convert this porosity of the hair? For that, we have to give deep conditioners. One of the conditioners we can give is that we can give oats, 3 tablespoons of oats, half cup of coconut milk, 2 tablespoons of honey, 2 teaspoons of olive oil. We can grind it and blend it as a thick paste, and then apply weekly twice in our hair, and hence we can change the porosity of the hair. I think I'm clear. Now, coming upon the Ayurvedic view of trichology, I'll just Kesha Paripalana starts from the Garbhavastha itself. We are studying Pidraja Bhavas. Kesha Paripalana starts from Garbhavastha. Then Dinacharya, we all know Nityam Tailam Abhyangam Acharet, in which all parts and all. Ratri Charya, how we take care of our hair at night, then combing, detangling, loose tying of the hair, etc., etc. Rudacharya, according to the Rudus also, we have to take care. Now, Shad Garbhagara Bhavas, Pidrabha Bhavas include Kesha, Lomam, Nagam, Smashru. Now, type of hair according to the doshas. Coming on to the doshas, when we analyze each strand of hair of a particular person, we have to analyze which dosha predominant is seen in that hair. If it is Vada, it will be dry, thin, and it will be quickly growing. Vaitiga, hairs will be oily, soft, straight, and moderate thickness will be there. Kafaja will be a balanced hair and a thick hair. Now, coming on to the factors which affects the hair growth, we know many factors. When a patient comes into our OP, first we have to take the history. So we have to ask about his family, his parents, his grandparents, everyone, uncle, and etc. So genetic factors, we have to ask him for if there is any hereditary issues, if any of his family members are having this baldness. In baldness cases, we have to surely ask that question. Then some will be saying that father is having, mother is having, uncles are having, brother or nobody is having, everybody is having hair, but I am bald, and so. They'll be telling. Then usually this genetic factor is a very important factor in baldness and all. But in my opinion, or in my experience, I have felt that most of their parents will be bald, but usually while asking about the baldness or the age of when their parent got bald, it will be around 45 plus years or 50 plus years, but the boy is still 20 years. So can we take it as a genetic factor that we have to think? Okay. Now, next reason which affects the hair growth is physical activity. It's very important, physical activity. Usually, many youths come for many hair issues. They will be bike riders and everything. They will be using helmets always, or we know nowadays 90% of youths use caps, that plastic caps and all. They will wear some sort of always straightening hairs, or always we can see those conditions, or they are always what to say, lifestyle. Their lifestyle is all in a negative mode. They are not properly maintaining a good lifestyle. So in these conditions, we can see usually baldness and other hair issues. Then the third factor, stress. Stress is a very important factor. In 99% of hair issues, we can see the stress is the predominant factor. First of all, they will be stressed due to some condition, their occupation or their employment or studies or anything, so and so. But on getting bald or on losing hairs, then this hair loss becomes their most prominent factor for the stress and all. And so stress is the most predominant factor. I felt that. So always a trichologist should be a good counselor too. We have to counsel them. I ask my patients not to look into the mirror for at least 1 or 1.5 months, because always they will be in front of the mirror and watching, oh, one hair strand has gone, one more has fallen out, etc., etc. So they will again and again they become more stressed. Okay. Now the next factor is food. Food, we all know, they usually in my opinion, I think most of the cases having hair issues, they will be having aseptic disease or some gastritis, or they will not be taking food at the proper time, or they will not be taking good foods. They will be eating more sugar, more non-veg, more fatty foods, more spicy foods, pitta vardaka aharas and all, they will be consuming more. So we have to give them a proper diet chart. What should they take and what should not they take. So I ask them to take more fruits, vegetables, dairy products, lean meats, nuts. We all know nuts have got revitalizing the hair properties and all. Usually some nutrients are required, especially for hair. That includes vitamin D, vitamin B12, vitamin C, biotin, calcium, iron, and etc. So we have to ask them to include these type of diet nutrition in their daily diet routine. Now sleep. Usually such youths are always found they are not having a good sleep or a timely sleep. They will be sleeping around 12 or 1 a.m. So we all know the detoxification in our body will not occur properly. So it usually affects mainly two parts of our body, that is the skin and the hairs. So we should ask them to sleep at the proper time, especially after 11 p.m. They should from 10:30 to 11 p.m. they should be in a sound sleep. They should be asked to take it as a daily routine. Then hormonal issues, we know many hormones have got effect on this hair issues, especially this prolactin hormone, testosterone, androgen hormones, and many sex hormones have got greater issues. Also thyroid stimulating hormones all have got issues on the hair growth. Now coming on to the underlying illness, we all know in ladies most of the cases for this hair fall is usually seen as PCOD, polycystic ovarian disease. So in these conditions, also in the allergic conditions, some people will be having allergic rhinitis, shavadu and all. In such conditions, usually I think the sebum production will be different from others, and hence usually they will be facing many hair issues in such conditions. Also in having gastritis or amla pitta conditions are also seen as underlying illness. Then also I have seen vitamin D deficiency is also seen affecting this hair growth. Now post labor, after delivery, most of the ladies will be having vitamin D deficiency, calcium deficiency, iron deficiency and all, and they will be having a large type of hair loss. Now increased use of cosmetics, usually this hair coloring, hair straightening, using hair gels and all will cause many cosmetic effects and cause hair loss. Then occupation, those who are working always under UV rays, those always this electricians, they will be always under high, this cooks, what to say, that pizza workers are always seen coming for these issues. They will be in high temperature, so high heat also will decrease the hair growth. They will be losing their hair very rapidly. Then bike riders always traveling, then electricians and all those who are always having dust particles in their hair, such workers are also seen losing their hair. Now the treatment methodology here given is, usually the history should be taken. It's very important. We have to sit and take the history very calmly. It may take sometimes around 1 hour. We have to ask them completely their history, their parent history, their occupation, their daily routine, what are foods are they taking, their lifestyle, all we have to ask and note in our prescription. Okay, then scalp examination, we should examine their scalp properly, what dosha of hair is they having, what is the porosity of their hair, what is the issues, how is the distribution of their hair, and etc. Then hair type examination, the dosha analysis, and we have to set a treatment protocol. Now, general management given in trichology cases are, first we have to give them a proper diet and nutrition. I already have said, ask them to take. Usually I ask them to take gooseberries and carrots, then green gram, sprouted green grams, then green leafy vegetables, nuts, egg whites, then soybean type of pea. I don't know how to say that. I ask them to include them in their diet. Also nuts, they ask them to badam and this walnut to include in their diets. Drink a plenty of water, keep their body very calm, keep their body very pitta shamana, always keep it as pitta shamana, maintaining a healthy lifestyle. Don't wear this caps and helmets always. Then showering is also a problem. Sometimes some say they are showering their hairs 2 or 3 times. It's not necessary, just 1 time is necessary. Then some say they are not showering for 4 or 5 days. That's also a problem. It will cause hyperkeratinization and affect the hair growth. So ask them to shower daily once only. Apply oil and give a good massage at least once in 3 days. Give hair packs in once in 2 weeks at least. Then apply egg white, castor oil, and in 10 days or etc. Or onion juice, etc. once in 10 days. Okay. Then periodic Shodhana therapy we have to give. We have to give Virejana, Nasya, and etc. Periodic Shodhana therapy should be given. Routine scalp Abhyanga routine, not only scalp, Shira, Shravana, Padeshu, we have to do Abhyanga daily. Use of herbal hair packs. I will give you some hair packs which can be given to them. Then mind calming exercise, it's very important to give them mind calming exercise, pranayama, meditation, etc. We have to talk to them. Usually we have to calm them. Trichologist should be a good counselor. Sometimes we will have to talk to them for 1 or 2 hours. They will be having some underlying problems or some mental issues or some sort of illness they will be having. So after speaking, they will get a bit relaxed, and they will feel, they should feel that we are a good listener. We will be able to give them some solutions. There should be a good, a rapport between the doctor and the patient. Then also give rasayanas. Many rasayanas we know. We can give the good rasayanas at the last stage. Now coming on to the common hair problems. I'll be discussing some common hair problems which we are getting in our OPs. This is dandruff. All of the photos I have taken from my OP itself. Dandruff, we all know, it's a condition in which scalp sheds skin in the form of white flakes. Here, we have to know, usually the common cause of this dandruff is said to be a yeast called Malassezia globosa. The cause for the dandruff, or the origin of the dandruff, usually it's said that the scalp always secretes oleic acid. And in some people, they will be sensitive to this oleic acid, and hence it penetrates into the upper layers of the skin and it causes inflammation there. When it causes inflammation, as a response, the skin will start shedding some part of the skin, and this altogether forms white flakes, which is called as dandruff. Okay. In Dharanaga, we know Dharanaga, it's a Kapha Vadaja condition. Kandu Keshachudi Parishyam Sasushma Tokspudanam is said as the Lakshana of Dharanaga. Usually in Ayurvedic aspect, treatment said is Shira Prakshalanam, then bowel correction, maintaining a proper lifestyle. Then we can give some type of lebanas in OP level itself. We can give some treatments. Always give some lebanas in the OP level itself. Give kashaya hair wash. Then the patient will feel very positive towards our treatment, and we will get a good result. So usually for this, we can use Triphala Churna, Neem Churna, then to paste in which, sometimes we have to paste it in dadi. Usually in dry skin cases, we paste it in dadi, and in this, this oily skin, we paste it in lemon juice. Okay, then we grind it and paste it in their hair for 1.5 hours. After that, we make neem kashaya, and we wash their scalp properly. We can repeat it once in a week. After 3 to 4 sitting, we can get rid of this dandruff completely. Now I'll give you some anti-dandruff pack, which we can provide in our OPs. The anti-dandruff pack will be containing neem leaf powder, lemon peel powder, medika churnam, then triphala churnam, yashti madhu churnam, henna churnam, henna powder, bringaraja, then hibiscus and curry leaves. We have to dry this bringaraja leaves, hibiscus, curry leaves, and make churna. And we have to, in equal proportion, we have to give them to pack it in either dadi or in lemon juice, according to the scalp, once in a week or twice, once in a week or once in 2 weeks, according to the severity of this dandruff. Now, the most common case we are getting is alopecia. We all know alopecia is a very common case in today's issues. This alopecia, there are different types of alopecia according to the distribution. The hair will be shedding in round areas. According to distribution, alopecia areata, which is concise to a small area. Then androgenic alopecia, AGA, that is alopecia, a pattern type of hair loss. Then alopecia totalis, which covers the whole scalp or around 3/4 of the scalp. Then DUPA, that is diffused unpadded alopecia. It's not much common, diffused unpadded alopecia. Now, we all know this is a case of alopecia areata. See, the skin has become very smooth, very smooth. The sebum production has increased and the skin becomes very smooth. So the hair follicles will not be standing there. The hair will shed off, and new hairs are not emerging from that area. And the distribution, it increases in size and Sometimes in one area this round occurs, and in some other area the round occurs, and then this both rounds will emerge to form a big area, and it will be spreading to form alopecia totalis. This is the case. It's a 10-year-old boy. This is a case which I have given treatment for an 8-year-old girl. 1, 2, 3 are the slides. First case having big spreading. She has been taken allopathic medicine for around 2 years. After that, in the first picture, that is the first stage when she came to my clinic. Then the spreading decreased to a smaller area. Then her hair come. This took around 6 months. These are different patterns of alopecias. So in alopecia, we have to consider that in male and female, usually it occurs in a slight different pattern. In this, no, not alopecia, that is baldness. Baldness occurs in a slight different pattern. That I'll be discussing in baldness. Okay. So the causes of alopecia, they are saying that the androgens are increased amount of androgens. They attack the hair follicles and causes thinning of the hairs. The hair becomes thinner and thinner, and it suppresses the anagen phase. Anagen phase is suppressed, and hence new hair follicles are not emerging from that area. So here usually testosterone is usually converted into dihydroxytestosterone. The important factor we have to keep in mind about alopecia is that the stem cells are never affected, or they are left behind in the bald areas. So while giving any treatment, it is possible to rejuvenate new hairs, especially we can by giving nourishment and other bloodletting therapies, we can rejuvenate in the stem cells, and we can reverse this balding areas, or balding process is reversible. That is the main point. Now this coming on to the androgenic alopecia. Androgenic alopecia is a pattern type of hair loss. Usually the temple portion and the crown, or any one of the areas affected, and later on the mid crown is affected more and more. The features of the androgenic alopecia is that thinning of the frontal hairline thinning occurs, and it become a little bit recessed in the temple areas, and then a pattern type of hair loss occurs. The statistics usually in this baldness and alopecia cases is that 3 to 5% occurs in late high school, 30% by 30 years, 50% by 50 years, and 80% occurs in 80 years. Androgenic pattern of alopecia. Now coming on to the baldness. Baldness, we know in baldness occurs in both male and female, 2 type of patterns. In males usually this is that I mistaked in that. In male, the front hairline goes back from the temporal side and hair thinning occurs. In male, baldness starts in this nature. In female, usually this in full scalp there will be hair, but the hair will be thinning and hair loss in this and that area, and not in a particular area. That is, the density of the hair will decrease. This is a type of baldness. Here, testosterone is converted into dihydroxytestosterone, and hence it is highly sensitive. The scalp is highly sensitive to this DHT, and the hair thinning occurs. The hair loses luster, and hence it causes baldness. DHT is a super potent androgen. It binds with 5 times affinity than testosterone does to androgen receptor cells. Usually this common area of baldness is the back of the scalp. Here the treatment therapy given should be, we have to keep in mind that Androgens can be manufactured in the skin or brought into the scalp by circulation or by bloodletting therapies. That we have to keep in mind while treating such cases. This is a frontal type of baldness, hair loss. Okay. There are some more cases that we have to discuss. One is hair thinning. We all know the hair becomes thin, very thin. Many patients are complaining about my hair is getting very thin and I'm losing the density of the hair. Usually, we have to keep in mind that the starting of baldness is not hair loss, it is hair thinning. So usually baldness starts as hair thinning and then only it leads to baldness. So we have to take care while a patient complains about hair thinning. Thick hairs are around, the size is around 60 to 80 microns, while thin hairs means 18 to 19 microns. Usually in hair thinning, the transformation of hair is first the hair, the terminal hair converts into miniaturized hair, then they convert into vellus hair. So the treatment protocol here given should be the vellus hair should be transformed into the terminal hairs. So for this, for hair thinning, we can use many type of pastes, like we can take the egg white and paste it with castor oil and apply in their scalp for around 30 minutes and then give a wash, or we can apply this fenugreek powder and onion paste in the scalp. This all can be done once in a week or once in 2 weeks. Okay. Or in this egg white in olive oil is also okay to be done. Now, another case we have to discuss is the hair graying. Hair graying is very common in our OPs. People are complaining about hair graying. We know Akala Nara. Akala Nara is a disease, but Kala Nara is okay. So in hair graying, we all know the hair is made up of keratin. A hair follicle will be containing melanocytes, and these melanocytes will be giving color to the hair. So in some cases, this melanin pigments will be affected and hence the hair will be losing its normal color. Then the causes, usually when we grow up, usually as people get aged, this melanin pigments will decrease in our hair and hence hair starts to gray. It's normal. But when it is below 30 years or 20 years, then it's a disease and we have to take care in such cases. Usually the causes said for this hair graying is genetics. Genetically, they will be sometimes having hair gray. Then it is, but still it is reversible. Then in some cases, the patient will be stressed. Usually in this divorce cases and widows, or will be graying, will be getting hair grayed in early stage itself. Then poor nutrition, nutrition deficiency, especially vitamin B12, folic acid, vitamin C and E deficiency will cause hair gray. Then in some people, smoking or increased use of alcohols will cause hair graying. Then underlying some health issues may also cause hair graying. Okay, in such hair graying, I will give you a pack, a hair dye pack, which it's not 100% effective, but we usually get good result. We have to ask them to repeat it once in 2 weeks. Ask them to come to our OP and we can paste them. There are 2 types of pastes. I think more effective is that we can first give them first pack of henna powder, then neem leaves, then curry leaves in tea decoction. That tea decoction we have to prepare in the way that we are taking 3 teaspoons of tea powder. We are boiling it in 2 glasses of water, and then it should boil, and it should retain to 1 glass of water. Then it will have a thick consistency. We are pasting this henna powder, curry leaves, then this flax seeds, then what to say, neem leaves, all we are pasting, grind it and paste it in the hair for 1 hour. After that, we are just giving a shower with plain water. After that, we are giving the second pack. We can give it in the same day, or we can ask them to come the second day. Usually people will be they will be taking leave from the occupations and coming, so we have it will be better to give on the same day itself. After showering and drying their hair, we are giving the second pack. The second pack, this first pack, a slight difference is that we have to grind it and keep it for at least 6 hours. Only after 6 hours we have to paste it in the scalp. Then giving after giving showering and drying the hair, we have to give the second pack. The second pack should be immediately prepared. It should not be set for 6 or 1 hour. It should be immediately prepared. Only after drying the showering and drying the hair, we have to prepare the second pack. The second pack especially includes indigo powder. All these leaves should be collected raw and dried. Don't use packet powders. It will not give result. We have to collect raw leaves. We have to clean them, dry them, unpowder them. That will give good result. Then this what to say, amalagi churna, then indigo powder, that is pasted in this tea decoction. Immediately after grinding, we have to paste it in the hair, in each and every hair, full scalp, and keep it for 1.5 hours. And after that, we have to shower it with plain water. That's a good hair dye. We can give it once in 2 weeks. Before giving this hair dye, give them 7 days Takradhara. Takradhara is giving good result in hair graying using Muttanga and this Nellika Amalagi. We are preparing Takradhara and giving them for continuous 7 days. After that, we have to give this hair packs once in 2 weeks. We can continue this for 6 or 8 sittings, including we have to give inner medicines, inner medications. We have to give Snehapana, Virejana, or we have to provide along with this. Okay. Now, another type of hair dye, some people will not be willing to come to our clinic and do this hair dye. In such cases, we can give them hair dye powders, prepared, already powdered. We can give and ask them to paste it in tea decoction or gomutra. It includes Nilini indigo 1 part, Amalagi churnam 2 part, hibiscus 3 part, henna powder 1 part, black seed powder 1 part. Then we have to prepare this powder and give them and ask them to paste it tea decoction or gomutram. And this hair colors usually stands for around 15 days to 1 month. 15 days is enough. After that, after 2 or 3 sittings, we can ask them to come repeat it only for after 3 weeks or all. We can give this 6 to 8 treatments, and it is giving good result. Now, another case we usually come around in our OP is trichomycosis nodularis. It is a fungal infection which occurs in the hair shaft. Hair shaft where the fungal infection. Usually, it occurs not only in the scalp area but also in the armpit and genital areas. Here, the treatment is, first of all, cut off that hair, and give Nimba Kashaya, Chalna, and other antifungal applications. Now, another condition which we come across is the telogen effluvium. Telogen effluvium case. It's a type of hair loss after a trauma, after any trauma. So that has got a big stress into a person's body. Usually, it might be an accident or surgery or postpartum or hospitalization or divorce or any cause that has caused some stress to the patient. So in that case, usually the body sends energy to the other parts of the body. In this case, Body sends energy to other parts of the body, that is the main vital organs, including heart, lungs, kidney, etc. And hence the hair loses its energy and it's get affected in Clylogeum effluvium. Now, next case is this seborrheic scalp, which I have shown this picture. The seborrheic scalp, it's very common case in our OPs, inflammatory itchy scalp. This is a before and after picture of a lab technician. She is around 18 or 19 years old.
Hello, ma'am.
Yes.
Ma'am, slide is not changing.
No, some pictures were not available of that telogen effluvium and all. I have not taken picture.
Okay, ma'am. Okay.
Okay. So this slide, I'm talking about the seborrheic scalp. It's the inflammatory itchy scalp. The reason might be, see, you can see it's a bit bleeding and itchy. You can see dandruff, white particles are there in the hairs. To say openly, the first picture was not the picture that was taken when she first visited into my clinic. I didn't take her picture because she was covering her hair. She couldn't expose her hair. It was full of itchy scalp, very ugly to see. So I didn't take picture. After 2 months, I took the picture. It was healing and it was regaining its first of all, it was very itchy and full of dandruff powders and all. Then the reason is improper cleaning and increased skin turnover occur in these conditions. Here more fungus multiplication occurs in the scalp and hence it consumes more fat is consumed and the scalp becomes more and more acidic. Hence the skin turnover increases and the scalp pH becomes more acidic and the scalp becomes more and more irritant, itchy scalp. So here the treatment given is proper oiling of the in the first condition we gave Kashaya Chalanas. Kashaya Chalanas were given. After the Vrinas were all dried, we gave proper oiling of the scalp and cleaning properly. Then she was stressed a lot, so meditation to calm her mind. Then in these conditions, seborrheic scalp, if smoking and alcohol is present, then it will adverse the condition. So ask them to avoid smoking and alcohol, avoid hot water showers, then to reduce the production of sebum. Then stress control should be also given. Now, treatment procedures usually done in my clinic is in the scalp. We firstly we give the pre-procedures. These pre-procedures are done before every treatment procedure. First, we do the scrubbing therapy. Scrubbing is Udvartana. Usually, Triphala powder is used. It's a good scrub. We use the dry powders in our hand and scrub it for 10 minutes. Scrub the scalp for 10 minutes. After that, rolling, derma rollers are used. Derma rollers, usually I use 0.5 to 1 mm size derma rollers. This is used and rolling is done for around 5 to 10 minutes. Then after that, steaming is done. Scalp steaming is done for around 5 to 10 minutes. These procedures are done as pre-procedures before every treatment. And treatments are been repeated in a week. They are asked to come once in a week. Now we go on to the main procedures. By scrubbing and rolling, we know the scalp will be very oily. No, the smoothness will in baldness cases and alopecia cases, we can see that the scalp is becoming very oily or very smoothy. Snigdhatva is increased. So we are scrubbing and we are increasing the rukshatva of the skin. And the skin becomes more ruksha. I think only in such type of scalp the hair sprouts, only if the snigdhatva is removed. So in such conditions, we are giving the scrubbing and rolling procedures, and steaming. By steaming, we can open every hair pores, and hence we can do our treatments, which will get easily immersed into the dermis. Now, the main procedures given in our clinic is the Raktamoksha therapy. For Raktamokshas, we usually use Kuttanam, Jaluga Avajaranam, wet and dry cupping according to the conditions. If the patient, ask the patient if he is willing to do Kuttanam, mostly most of the patients will be given only one Kuttanam. After that, they will be phoning us and asking if the treatment is Kuttanam, then I will not be repeating the treatments. They will be complaining of that. So only very few patients are ready to repeat this Kuttanam. First Kuttanam we give, after that we ask them or they ask us if the treatment is Kuttanam, or if it is Kuttanam, they will not be taking the treatment. It's a bit painful. We all know usually it is done with lancet, blood lancets we are using. So we are not applying any thing before that. In some cases we can apply aloe vera gel, but mostly we don't apply anything. We just scrub, roll, steam and do this Kuttanam using blood lancets. Uniformly given in that areas, it's very painful. The other therapy is the Jaluga Avajaranam. We all know Jaluga Avajaranam. It's we can do in Sukumaran also. It's not causing any difficulties to the patient. So Jalugas, they are first rolling, scrubbing, rolling, steaming are done, and then Jaluga are given there. The Jaluga will take blood. Here we are saying that this Jalugas usually we all know they are they are having hirudin and they consume usually the deoxygenated blood. They prefer the deoxygenated blood. So while we are inducing this Jaluga into the scalp, and after taking the Jaluga and asking and allowing the Jaluga to spit the blood, usually the blood is very black colored. Deoxygenated blood is removed, and hence newly fresh blood will be flowing. This is the cupping therapy. While doing this, we first give dry cuppings. We give dry cups first. After giving dry cups, we give small pricks with the blood lancet, and after that, the wet cupping is done. We are doing this by using machines. Okay, this is the Raktamoksha therapy. I think it is very important in hair issues. Usually this shouldn't be repeated more than, it is repeated only in once in 3 weeks or 4 weeks. The Raktamoksha therapy is repeated, or else it will cause health issues to the patient. The patient will get tired, etc. So next therapy we are giving is the oil massaging therapy. It's a very important therapy given in our clinics. Oil massaging with importance to the marma pressure points are given. Usually we all know there are many important marmas in our scalp, which includes, we all know there are many marmas. They should be properly massaged. First of all, the first marma massaged is the Stabani marma, which is located in between the eyebrows. Here, one finger gentle massage is done, first in anti-clockwise direction and then in clockwise direction. The patient should be sit in a proper posture, and the doctor should stand behind the patient, tilt her head backwards, and then do the Stabani marma massage. It is done for, we all know the Stabani marma is the center for the central nervous system. Hence, it is massaged gently with one finger in anti-clockwise and then clockwise direction. After that, we have to move to the Avartya marma, which is located in the eyebrows, in the center portion of each eyebrows. We should massage the Avartya marma using both hands. It relaxes eyes. Now, the next area we have to massage is the most important point. That is the Adipati Marma. The Adipati Marma, we all know, it is the soft spot. Usually in newborns, all we see a soft spot. Padap, we call it padap, in soft spot in the scalp. It is located around 8 fingers above the eyebrows. Then this by massaging the Adipati Marma, we should, it is the first part where the oil is being applied. Then this massaging the Adipati Marma, it relaxes tension, headache, then depression all will be released, and the patient will feel calm enough. Now, after doing this Adipati Marma massage, we have to go on to the next Marma, that is the Simanda Marma. The Simanda Marma is the second part where the oil has to be applied. We know it is 12 fingers above the eyebrows. And this Simanda Marma, usually 12 fingers above the eyebrows, and it is known as the skull spot. This this skull spot is the most highest point in our body, and hence the gravitational force will be high, and the hair loss will be more in that area. Usually baldness starts in this Simanda Marma. Next, this after massaging the Simanda Marma, we have to divide the whole hair into 2 parts and then massage each and every hair follicle. Then after massaging Simanda Marma and doing that, we can go to, we should go to the next Marma, that is the Krigadika Marma. The Krigadika Marma is situated 4 fingers above the neck. It is situated at the lowest part of the cervical vertebra. We should give gentle massage in the Krigadika Marma, and hence it decreases this study related headaches and all. Usually for students, it's very effective. Then after massaging the Krigadika Marma, we should tilt the patient's head a bit forwards and then massage well so that the blood gushes into the scalp more. Then next, after Krigadika Marma, we have to go on to the next Marma, and that is the Vidura Marma. The Vidura Marma is located in this part behind the ears, and we are massaging it. Only gentle massage with small pressure should be given. This gives sound sleep and better hearing to the patient. Then after Vidura massage, no pressure should be given in the Vidura massage. After Vidura massage, we should massage the hairline behind the ears, both hairline. We know this ear massaging, Shravana Abhyanga is very important. In Nityam Abhyanga, Shravana, we should do our oiling daily according to Ayurveda, Shiras, Shravanam and Padam. Then coming on to the Shankha Marma. Next, 7th Marma is the important Marma, is the Shankha Marma, which is located on either part of the forehead. We should give gentle massage on the Shankha Marma using thumbs and fingers. It calms brain a lot, and it is good for stress management, anger management, insomnia, anxiety related headaches, etc. So give a good Shankha Marma massage. After giving these massages to these 7 marmas, we have to massage the neck and shoulder part. Only then the oil massaging is complete. This is very good in hair treatment conditions cases. So this is the oil marma or pressure point important oil massaging therapy. Now we can give a lot of Shiro Lebanas. These are different type of Shiro Lebanas we are giving. I have told some Lebanas, that is in henna hair pack we can give, then anti-dandruff hair pack, anti-hair fall pack, anti-graying pack, protein pack, and all can be given. I will give you some hair packs. I have told about anti-dandruff hair pack. Now I will tell about anti-hair fall pack. Anti-hair fall pack, one type of pack is that Triphala Churnam, 3 teaspoons. Then 1 teaspoon each of Bringaraja Churnam, Yashti Madhu Churnam, Shikakai, Brahmi Samulam, curry leaves, indigo powder, hibiscus, 1 teaspoon each. We can keep it powdered and we can pack it in the hair. For increased effect, we can add flax seeds and all. Then anti-graying hair pack, I've already said here. Henna hair pack using henna and amalagi churnam. We can give henna hair packs. Protein packs are usually given using olive oils, castor oils, egg whites, then fenugreek powders, then this one, what? Onions, etc. We can give protein packs. Also, we can use Ulpala Churnam. You might be knowing Ulpala Churnam. Ulpala Churnam in milk is a good hair pack. These all hair packs we should give according to the condition of the scalp. This anti-graying hair pack. Now, other treatments we can include in our OPs are Nasyam. We can give Nasyam. Then Virejanam. Virejanam should be given better in once in 15 days or once in 3 weeks. It will be better to give them Virejanam. Vibhati Virejanam is enough. Then we can give Snehavasti, usually Tikta Rasa Pradhana, Snehavasti, Astidhadu Vardhanam. We know Astidhadu Vardhanam is this Tikta Rasa Pradhana, Snehavastis are Astidhadu Vardhanam, and this Astidhadu origin of Kesha Lauma Smashru all are from Astidhadus. So it will be better to give Snehavastis. Takradara is a very good option. It promotes hair growth. It reduces premature graying. It increases the hair density, hair luster, hair becomes more smooth, hair density increases. It's a very good therapy which can be given to hair patients. Takradara. In this, we have already told about hair thinning, hair graying, split ends. We have to say about the split ends. In these cases, usually split ends we usually see in our OPs. The patient will be complaining the hair ends are splitting into 2 or more parts. It is also called as trichoptilosis. Split ends are called trichoptilosis. Then here the hair shaft splits into 2 or more parts. Then in these conditions, the cuticle gets already ripped off, or it becomes, the cuticles are becoming damaged. The causes of this split ends usually seen are excessive UV rays exposure, excessive sun exposure, in improper detangling. They are not tangling their hairs properly, or they're not carrying their hairs properly, not combing hairs, excessive this blow drying, using dryers, hair dryers excessively, also coloring agents, using increased coloring agents will all cause split ends. When in these cases, we have to do proper oil massaging. The oil massaging should be taken care not only in the scalp but also in the end part of the each hair. Should be massaged well and properly massaged. Okay, then head lice. Coming on to this head lice. Head lice is a very common case which are seen nowadays. Most of the children, most of the parents will be coming with their children full of head lice. We all know about a condition which occurred for a Caitlin Yoziak, a 12-year-old girl. She died because of this head lice. We just cannot imagine that. Due to this lice infection, a girl is dying. So it caused severe anemic cause. This head lice caused severe anemic cause, and then the girl died due to cardiac arrest. So usually younger children and senior citizens are affected. Not only younger children, but senior citizens are also complaining about this head lice a lot. Here thousands of lice will be there, and hence there are thousands of lice. Amount of blood sucking by the lice will cause increased blood loss, severe anemia. Okay. Then here we can give a hair pack given for head lice. I will say Nimba Patram, Vaja, Kargogilari, Tulasi. We can Vaja, Tulasi, Kargogilari, Nimba Patram. We can prepare a hair pack and apply it once in 10 days. hair pack it in once in 10 days. After that, we have to give them a shower, and after that, we have to give Dhubanam. For Dhubanam, we have to use Kundirikam, then this Vaja, Gugulu, Shanga Pushpi, Velutulli Toli, all we have to use for Dhubanam. And it is giving very good result. Then I can give you a head lice oil, which is giving very good result. Head lice oil, which are preparing, anti-lice hair oil, which we are preparing in this our clinics. It is coconut oil. For 250 ml coconut oil, we are adding 10 gram Triphala churnam, 10 gram neem churnam, 10 gram orange peel churnam, 5 ml neem oil, and 0.2 gram of camphor. We are preparing in normal thaila preparation way, and we can add some essential oils, that is 10 drops of tea tree oil, 10 drops of peppermint oil, 10 drops of eucalyptus oil, and this is ask them to apply daily a little bit of oil. Always oiling should be not in a huge quantity, only a little bit of oil should be applied in the scalp. Then it is giving very good result. This is a case which was which had visited our OP. It's a case of SLE. In the SLE case, the patient was having severe infection in the scalp, and you can see a Bruna type in the scalp. We gave Triphala Chalana for continuous days, for some continuous days. And after that, you can see, after that only we gave some treatments like Joluga Vajarnam was given only after the Bruna Robana occurred. You can see it is healing, reducing its size, and the hairs are coming. Now, there are some yogasanas which we can give in our, which we can ask them to do. Shirshasana, the headstand, this all increases the flow towards the blood flow to the scalp, and also it can increase the hair density, hair growth, reduce premature graying, and all. Shirshasana, Adho Shavasana, downward facing dog pose, Vajrasana, Sarvangasana, Uttanasana. Uttanasana is very easy to do, so we can ask every patient to do this in their homes. The Sarvangasana is the best one for hair growth, but it's a difficult one. We cannot ask everyone to do it. This is a case. Our baldness treatment, you can see first, second, third, and fourth stages of hair growth. Before and after picture. This is a lady. Now we'll come on to some common face disorder, common problems affecting face in which are visiting in our OPs. First one is acne. We all know acne is very common in our OPs. In these cases, we have to give internal medicines, especially Manjishtadi Kashayam is giving very good result in this reddish pustules. We can give Manjishtadi Kashayam with Dushi Vishari Gulika, or after that, after this has subsided a little, we can give Drakshadi Kashaya. Then in some cases, we'll have to give Guluchadi or Padola Gadroinyadi or Tiktaga Kashayas. Guligas include Dushi Vishari, Villuadi, and Abedi. Arishtas also, in some conditions, we have to give Arapada, Sharipa, Nimbamruda, Kadirarishtam, etc. Always give Avibhati Virejanam. Avibhati Virejanam in mild dose, daily Avibhati Virejanam in mild dose. Also for Shalna, we can use Haridra, then Nimba, guava leaves, Triphala for Shalna. Easy way is neem decoction also can be used to wash the face daily. always give cleansers. Daily cleansers should be given, especially Triphala Churnam. Not Triphala, the Triphala Churnam is enough with rose water. In normal skin, rose water should be the medium in normal skin, but in some skin, in dry skin, it is creating problems. So in such skin, we have to give milk or curd as the medium for this cleansers. In oily skin, we can give lemon and honey mix as medium. Then use this Yeshti scrubs. Yeshti scrubs are giving very good result. Only after it has subsided a little bit. In big pustules, we can give Jalugavacharnam also. Then neem powder scrubs also can be given. Then we can give also moisturizers like honey or rose water moisturizers can be given in later stages. Now, another one is the eye dark circle. Eye dark circle is also very common. Most of the people are asking about this darkish circles below and around the eyes. In this condition, we have to ask them to have a good sleep. They will be not sleeping at the proper time. Then also we have to educate them of having good sleep and also having mental calmness. They will be stressed due to some conditions, and then this type of circles will be arising. So in this condition, we can massage with Yeshti and Aragoda Churnam in milk also. We can give Shirabala Thailam and castor oil, gentle massage at bedtime. Then another one is that coconut milk plus aloe vera gel plus vitamin oil with rose water, we can blend it together and make a paste and give a daily massage. These all can be given. Also ask them to sleep at the proper time, drink plenty of water, always wash their face with plain water, with fresh plain water, especially eyes. Then give good eye exercises. We know palming exercise, blinking exercise, also give good rest to exercise. Then pen pointing exercise, all can be ask them to do it. Now I'll give you an under eye gel which we can prepare in our OPs. Under eye gel, that is which include aloe vera gel 1 teaspoon, Yeshti Madhu Churnam ½ teaspoon, wheat germ oil 3 drops, honey 1 teaspoon, vitamin E 2 drops. All should be mixed into a uniform consistency, and we can give this in our OPs. It is giving good result. Ask them to apply this daily twice, especially at bedtime. Now, next one is melasma. We all know melasma is very common in our OPs. People are complaining of this blackish Karimangalam. We say this Karimangalam. 100% result we cannot assure, but we can give good relief to this blackish color. For that, usually this stress management is important. Good water intake, good sleep is important in all skin cases. It is important. In this, we can give a paste. Eladi Churnam with curd should be made paste and kept for ½ an hour. Then after Eladi Churnam with curd, kept for ½ an hour, and then massage it for 15 minutes. Usually massage it in this pradiloma direction, and then after that, after 15 minutes, remove it with a cotton and apply milk or honey for some time. This is a good powder which reduces melasma. Also, we can use white sandal powder with curd, milk or honey according to the condition of the scalp. Then another one is Jalugavacharnam. In some conditions, Jalugavacharnam is needed. Then Ixora flowers with buttermilk labana is also giving the result. Then another one is cucumber pulp with Yeshti Madhu Churna is giving result. Then Manjishta with Vaja and honey paste is also, in some cases, it is also giving result. Then stretch marks. Stretch marks are for melasma. I will say you an oil which is giving very good result, which we can prepare in our OPs. Oil which includes, usually we are giving this in melasma condition, also in hyperpigmentation conditions. Draksha Dadima Swarasa is taken. Then Manjishta Churnam 12 grams. Yeshti Madhu 24 grams. Goat milk 1 liter. Tila Thailam 500 ml. The kalka is made with Yeshti Manjishta Churnam with Draksha Dadima paste. Strain it as thick paste, and this is made into kalka along with this ajakshiram. Half part of ajakshiram is used to make kalka of this yashti, manjishta churnam and draksha dadima paste. The thailam here added is tila thailam. The dravam is ajakshiram and kalka is this yashti, manjishta churnam and draksha dadima paste. Oil is prepared according to normal oil preparation till Kharapaga is obtained and the kalka becomes worthy. It's a very good oil which can be given in melasma conditions and hyperpigmentation conditions. Now the next one is stretch marks. Stretch marks, usually people complain of the stretch marks a lot, especially post-labor conditions. It is seen not only in post-labor conditions, in some adolescent children also it is seen. So here we can give Nyavara. Nyavara is giving a good result. Shashtiga is giving a good result with Manjishta Kashayam. Also, this Shashtiga Pinda Swedam, Kiris are giving result, or else we can give as the Shashtiga Lebana with milk can also be given. Then Malli Kalkam, coriander paste with Venna application is giving good result. Then another one is Kolaguladaji Churna with Prabhanjana Thailam can be given. After that, we can apply Shaddha Udakridam and all. So these are some of the ways we can get rid of the stretch marks. Usually we prepare a oil for the stretch marks also. It is giving very good result to remove stretch marks. Dandruff related pimples all are removed by this oil. This oil include Swarasa of Desmodium triflorum, Nimba and Haridra. It is this Swarasa is mixed with coconut milk. Usually we take 3 coconut milk, then add Mediga paste, fenugreek powder or paste. Then oil is prepared. The preparation is like virgin coconut oil, and tilatailam is added at the end. This oil is giving a very good result in stretch marks. Now warts. Warts are also very common case which are seen in our OPs. Usually warts, the patient usually complains of warts on the face, neck portions. They are usually complaining. While yesterday a patient came just here in the corner of the eye, the wart is there, and in such cases it is very difficult. Usually in this wart cases, we can give a preparation using this Kalyanakasharam, Villuadi Guliga, and Chunnambu. What to say for Chunnambu? That mix, we give it as 2:2:1 ratio mix and ask them to apply continuously. And we continuously ask them to apply on the warts, then so the warts get reduced in size and they fall off. We can give internally, we can give Nirgunyadi Kashayam, Manjishtadi Kashayam, Paishwara Gugulu and all. Always better to give Gandhaka products internally, especially as HS along with Palkani and all. Then we can give this Tuttam applications also are giving result in wart condition. Now, next one is hirsutism. We all know hirsutism is a very common condition. Always there will be some underlying issue in hirsutism. Mostly condition PCOD. PCOD cases will be having this hirsutism, hair growths, not only in this area, but also kridava, this beard, mustache, then in the chest, around the nipples and all, hair growths are usually seen. Ask them to firstly ask them to treat for that underlying issue. If it is the PCOD, then the PCOD should be surely corrected. Along with that, we can give some applications, ask them to remove the hairs. In this condition, there is a lot, but in 2 or 3 or some hairs in this area, we can ask them to remove the hairs and then apply this Gandhaka Rasayana tablet. With first give Triphala Udvartana, Triphala scrub can be given, Triphala Churna scrub for a few minutes. After that, we can ask them to apply Gandhaka tablet with honey, can be applied at night. Then better, it is a good option is Haridalam, Manashila and Shanga Basmam can be mixed and applied. Then also another mix is Gandaga Churnam, Anashila with Laksha in lemon juice is also given. Lomashadana Thaila, all, but we cannot we cannot assure completely, we cannot assure that it will never return. In most of the cases, it is seeing return, especially if the underlying illness is staying there. Now, another one common cases usually girls are asked for the lip colors. Lip is getting blacker color. Usually, adolescent girls are asked. In that condition, we can ask them to use Karjuradi Mandam for Panam regularly, and then this grape juice. Old grape juice can be applied, it's good. Then also another application is lemon, honey and rose water combined application can be given. In lip dryness condition, some complain about lip dryness. In such conditions, coconut oil with butter application is also good. I think these are the common conditions which are coming into our OP. Doctor, can I hand over for the doubt clearing session?
Yes, ma'am, sure. I hope you can see the screen. Some questions have already come up in the chat box. So we'll start with that first. Participants can add your questions to the chat box, or you can use the hand raising option and ask the question directly. So first, Dr. Rekha has asked, ma'am, can you mention the combination of the hair conditioner once more?
Wait a minute. I think she's asking about the deep conditioner for changing the porosity of the hair from low porosity to hair porosity. Yes. That is the oats. We can give oats 3 tablespoons, then coconut milk 1/2 cup, then 2 teaspoon, 3 tablespoon honey and 2 teaspoon olive oil. We can grind it into a paste and apply well on our hairs, and this can be done twice in a week.
Thank you, ma'am. The next question is from Dr. Taj. Ma'am, can the use of conditioner double hair fall, or can you suggest a good hair conditioner?
There are many hair conditioners. I think then this what to say, the onions are a good hair conditioner. Onion paste and this castor oil with Mediga Churnam, it's a good hair conditioner. We can apply it properly, and then we can wash off this. Then there are some also with that there is a combination with what to say, potato paste along with this castor oil preparation. It's also a good conditioner. It is a good conditioner we can give in our OPs. Next question. Hello.
Yes, ma'am. Related to that, there is a question from Dr. Rashmi Priya. Does onion paste cause graying of hair?
No, onion paste is not. We are not feeling that it is. Many of the students usually ask about onion paste because it is having some sulfur content. But in my experience, I have not felt so. But I don't use lime or more content usually in the hairs because I am afraid if it either it may cause this hair graying, but onions are not causing such problem. This big onion, not big onions, small onions are used. Small onions, even in this alopecia cases, after scrubbing, rolling, and after doing Rakta Moksha therapy, we usually cut the tip portion or the front portion of the small onions and then rub this onions on the Rakta Moksha done spaces, areas of alopecia. It is giving good result. Also after, as a post procedure, also this we can use the Thura leaves. The Thura leaves also can be rubbed in this alopecia areas as a post procedure.
Thank you, ma'am. There's one more question related to the use of conditioners. How long should hair conditioners be used? Like the frequency or the how much time should we leave it on?
Usually conditioner should be left for almost half to 1 hour. It depends on how your scalp is. And frequencies, usually conditioners can be used once in 2 weeks. Once in 2 weeks.
Thank you, ma'am. Then the question is from Dr. Rashmi Priya about the causes of hair thinning, and should we apply the pack for hair thinning twice a week?
In hair thinning, always you should take in mind that usually I have seen all Ayurvedic doctors go for any hair issue cases, they go for leavenas and oils only. Here, scrubbing and rolling is very important in hair thinning cases, hair loss cases, hair density decrease cases. I usually give all my patients the scrub powder and derma rollers and ask them to do it daily. Usually, I give of 0.5 mm and ask them to do it daily. Daily ask them to scrub. I also tell them that it is more important than oiling and leavenas. Because first, I have already told you that first we have to change the scalp surface. It has become already very smooth. Then we have to change it from, we have to reverse the snigdhatva to rukshatva. Only in that rough scalp, the hair will be rising. According to my experience, I have seen only in that condition, it is the new hairs are getting aroused. Also, the hair is getting more nourishment. So in these conditions, we should give more importance to scrubbing, rolling therapies, and only then the need is there for oiling. You can do oiling, you should do oiling once in at least 3 days, but more important is scrubbing and rolling.
Thank you, ma'am. Ma'am, can you show the Krigadiga Marmam for massage?
Krigadiga Marmam is in the back side. You will be studying in Marma. We are studying now in our Marmas. So Krigadiga Marma is in this. It is in the neck portion. Just C7 vertebra. You know C7 vertebra, the protuberance. It is at the tip of at the last tip of the C7 vertebra. It is there is the Krigadiga Marma, and it is the end of the cervical vertebra, and it is 4 fingers above the neck portion. 4 fingers. I don't know how to show it. 4 fingers from the neck portion at the tip of the C7 vertebra is enough. So here we are giving gentle massage in both these areas to the Krigadiga Marma. There are 2 Krigadiga Marmas. We are massaging in this form.
Thank you, ma'am. The next question. Ma'am, your experiences or how to treat post-COVID hair fall?
It's a very big headache. Most of the patients who have already treated for hair falling and they have regained their hair health, now they have got COVID, and after as a post-COVID issue, they are all complaining about that hair issues. I don't know. I am giving them this scrub powders, and internally giving them Rasayana preparations, especially Chavanaprasham and all. This also some biotin tablets. We can give some biotin tablets also as a supplement for this. Ayurvedic biotin tablets are there. Then we are giving along with this and asking them to come to the clinic and do some oil massaging once in 2 weeks. Hoping we can get rid of this.
Thank you, ma'am. The next question is from Dr. Sridevi. Ma'am, along with system systemic medications, any medicated hair oil found to be effective in premature graying?
Okay, Sridevi doctor. Usually here in our clinic, I prepare a hair oil. I'll give you that preparation. It is seen very effective in anti-graying. Where is that? Okay. This is the one which I prepare in my clinic. That is 1 liter coconut oil with 50 gram black seed powder, 50 gram fenugreek powder, 20 gram green tea leaves, 10 gram amla powder, 10 gram henna powder, 10 gram indigo powder, 5 gram curry leaf powder, and 500 ml castor oil. This is giving very good result in for anti-graying. This is the one prepared in my clinic. Also, there are some oils, there are some classical medicines, including Prabondrigadi, Karam and all, but I feel this oil is giving much more result in anti-graying. Okay. I think you've got the combination: coconut oil, black seed, fenugreek, green tea leaves, amla powder, henna powder, indigo powder, curry leaf powder, castor oils.
Thank you, ma'am. Ma'am, can you suggest internal medicines for melasma?
Melasma internal medicine, usually we give Drakshadi Kashayam. Drakshadi Kashayam, I usually give it with its Anupana itself, Madhusida Laja. I think it is giving some result in melasma, but melasma is not completely, we cannot assure the patient that we can cure it. Sometimes it is taking a lot of time, or sometimes it is not getting completely cured. So I usually prefer Drakshadi Kashaya, give daily Virejanas. Then after that, we can give, along with that, we are giving some external applications also. Then medicine, I go for Drakshadi.
Okay, ma'am, thank you. Ma'am, is methi dana paste good for hair?
Pardon?
Methi, I think fenugreek, methi dana paste.
Fenugreek powder, is it good for paste? Is it good for hair?
Hair.
Sure, obviously it is good. But all these applications we should do according to our scalp. Each and every scalp is different. Each and every hair is different. Each and every dosha predominance is different. Each and every condition of the scalp is different. So we should examine the scalp, and then we should decide which type of labana. I have told you a lot of labanas. All are not effective for each and every patient. Some are good for some people, some for others. So we should first study the scalp and then give the applications. Usually Mediga or fenugreek powder is a good labana.
Okay, ma'am, thank you. One more question from Dr. Sridevi. Ma'am, changing medicated hair oils, is it a bad practice, or should we change oils as our age and health condition changes?
We need not change always the hair. We should, if the patient is suffering from any kind of issue in the hair, if it is first of all, I always go for the Rudirapatradi or Malatyadi in first stage. Even if the patient is not having dandruff and all, first I give some Ushna type of oil, and only after that I give for I go for Shida type of oil. Mostly in my clinic nowadays, I am preparing all oils, hair oils, all are I preparing by myself and giving them. So first we give Ushna oils, and then slowly we convert them into Ushna Shida and then Shida oils in every condition. Even if the patient might be not having dandruff and all, but I go for that. And I think it is more good for that. First, first just the patient come and we give them some Kundala Gandhi or this, it's not a, I don't think it will be effective in such situations. First, we have to, every time we have to give importance to scrubbing and rolling in the first stages. Only then oiling is important, but later we have to stop the scrubbing and rolling, and we have to give hair packs and oiling only.
Okay,
Am I
ma'am,
clear?
one more question from Dr. Sridevi. While using Pitta Shamana treatment for hair, does it hamper vision or aggravate conditions like cervical spondylosis in women, ababahuga in women, or cataract occurrence? Have you observed any such relation?
I didn't get, I'm not clear with the question. While using Pitta Shamana, pardon?
Pitta Shamana medications, I think, for hair. Just written using Pitta Shamana things for hair. Will it hamper vision and cause other conditions like cervical spondylosis?
Never, never, never. How can it cause cervical spondylosis and all? We are giving this Pitta Shamana medicines internally. If a patient is coming first to your clinic and we are taking the history and we are asking about his lifestyle and he is saying, we are asking some questions. That is, we have to diagnose, or we have to understand the root cause of, if it is a hair issue case, we have to first understand what is the underlying cause for this hair issue. Hair never falls off by itself without any reason. There will be some underlying reason. Main reason is dandruff and all, dandruff or seborrheic scalp and all. So for dandruff conditions, first we have to give this Nimba Chalna and all. Internally, we have to give Nimba Kashaya, or in severe cases, we might have, we should sometimes give Aragodadi or Padola Kadroinyadi and all. Then in some cases, dandruff issues, pustules and seborrheic scalp will be occurring. In such conditions, we should go for Manjishtadi or Gulujyadi Kashayas. In every kashaya, it's better to give Pitta Shamana Virejanas, like Avibhati. Avibhati is enough. Avibhati Virejanas in a daily way. That is, we can give 10 gram Avibhati with hot water daily, or 5 gram Avibhati with hot water daily. Along with that, we have to change the oils. We have to give internal medicine. Now, some patients will not be having any dandruff issues, but they are complaining about hair loss. Then we have to look for their digestive system. What is the how's their digestion occurring? They might be having acid peptide disease or amla pitta or headache or this gastric irritations and also in such conditions we will have to move on to Indukanda Kashayas or Gandharvastadi Kashayas, sometimes Chiruvilladi Kashayas. In such conditions we will have to treat in that case. In some conditions, they will not be suffering any gastric irritation. Then we have to ask them if they are having any allergies, or they might be in their childhood, they might be suffering from asthma, allergic asthma, and they have used a lot of inhalers, or they will be having, while taking blood test, we will see their IgE level is very much increased. Their eosinophil level is very much increased. In such conditions, we will sometimes have to move on to Dashmula Gadatraya Kashaya, Villuadi Guliga in that sense. So there the treatment should change to allergic reducing Kashaya should be given internally. In some condition, this will also not no such reasons are there. Then we have to test for vitamin D. The vitamin D will be reduced. Usually the patient will not be complaining about any health issues due to vitamin D deficiency, but increased hair fall is there. Then while testing for hydroxy vitamin D, it will be showing around 7 or 8 and all. So in such condition, we will have to go for vitamin D promoting medicines, usually Tiktaga Kashaya or the Gugulu Tiktaga, along with some vitamin tablets are also seen effective. Sunday Smart and all tablets are also seen effective. So we have to look for the underlying cause, not only the oils and external applications only. First, we have daily, it's better to give daily Virejanas. Always in the treatment protocol, there should be a Kapha Pitta Shamana. Kapha usually because the area is kabajam, and Pitta Shamana, Kapha Pitta Shamana should be the treatment protocol, but it will never cause any cervical spondylosis. How will it cause cervical spondylosis or any vision deficiencies? It doesn't cause any such effects in my experience. Don't know. Doctor?
Thank you, ma'am. Ma'am, so there are a few more questions. So shall we go on to the next one?
I think I'll answer 3 more questions. Then can we
Okay, ma'am.
answer the rest of the question in the WhatsApp group?
Yeah, sure, ma'am. So we'll answer a few questions about the male. Any cream preparation for suntan skin, especially for males, for thick black tanned area in the forehead?
Usually in this suntan is a great cause in today's in this environment. Most of the youths are complaining about the suntans. Usually we give some powders including Manjishta, the churnas and applications we give along as face packs. Also this cleansers, Triphala cleansers are given. Also along with that, Shashtiga Lebanas are given. I don't prepare any creams and all. I haven't prepared. I have to prepare, I know. I am getting ready for the next step to prepare creams and gels. I think it is included in some other sessions. Some sessions are, I think it's included. Okay.
So I think we'll wind up with one more question, ma'am. So what can we do for the growth of mustache and beard?
It's a big problem. Most of the people are complaining. They are asking for that. Usually, I don't have a proper medicine for it, but I usually give some oils for this hair growing hair oils, also some hair serums which are giving result in this case. I am preparing a hair serum. I will give its preparation. The hair serum I am preparing is include 5 ml of castor oil, 5 ml of olive oil, 5 ml of onion seed oil. Then 3 to 4 drops vitamin E oil, 2 drops tea tree oil, 2 drops rosemary oil. These oils are mixed in a added in a double boiling method. First castor oil is taken, then to that olive oil is added, blended properly, double boiling method only. Then onion seed oil is blended properly, then vitamin E oil 3 to 4 drops, then tea tree oil 2 drops, rosemary oil 2 drops. These are blended properly and given as sprays. This can be used in hair growths also. Ask them to now it's a age of hair serum. Patients are asking for hair serum, hair gels and all. So this can be sprayed only after this scalp has become rough and the hair is emerging. Only in the later stages we can give this hair serum and ask them to apply it in the scalp. Also they can apply it in the mustache and it is giving results. Okay, then the other hair oils which we are preparing for hair growth also can be applied. Some patients come and say hair is growing very slowly, but the beard is growing very rapidly. They are saying that. So it can also be applied in the beard and mustache.
Thank you so much, ma'am. So I think we'll wind up the session for today. The rest of the questions.
Hello, ma'am. Just one last question I would like to ask. One last question. Ma'am, Nasya treatment in for skin and for hair.
Okay.
What kind of you use it?
I use usually, we have to look for the scalp, if it is Vadija, Kabaja and all. Usually we give, first we give Bringaraja Swarasa Nasya in small dose. Then after that, we give some this Karpasastyadi Nasya in some conditions. Dhanadara Nasya in other conditions. We can give according to the conditions. Usually Karpasastyadi I prefer. And give according to the dosha of the scalp and the patient, prakriti of the patient, we can give different nasyas. Okay, we just give it as a not in a heavy dose, not as a Marsha Nasya. Daily we can give in a small dose. For small dose means first we start with 4 or 5 drops, then we can increase it slightly up to, we can add up to 10 drops. That for 6 or 7 days we give it. Okay.
And ma'am, for melasma, like
Melasma conditions, I have not given Nasya.
okay, or any other
It will
skin
be
condition?
better. It will be better. I think it will be better to give Nasya, but I have not, in my experience, I have not given.
Okay, fine, ma'am. Thank you, ma'am.
So we'll deal with the rest of the doubts in our WhatsApp group. Just reminding everybody that we'll not be forgetting your questions. You can ask us anytime in the WhatsApp group. So thank you so much, ma'am, for spending your time with us today. You gave us very clear insights on the most common things that we are facing in our clinical practice right now. So all participants are greatly indebted for your wisdom right now. Thank you so much, ma'am, and have a good night. Keep supporting us in being a part of Team CME again. Now, thank you to all dear participants. Have a very good night. Thank you for your cooperation.
So thank you to CME. All the best for your ongoing ventures. Thank you all. Good night.
Good night.